I'm in the Army, and when I was diagnosed with cancer, I was just getting ready to deploy. And it was a sad moment in my life, but the team of doctors...
I was diagnosed with breast cancer in April of 2014. I had to have a lumpectomy, and then I had to have lymph nodes removed, and then I had 33 treatments of radiation.
So I started with a lumpectomy pretty much immediately following my diagnosis. That did not produce clear margins, and the decision was made to do a second surgery 2 weeks later, which was a double mastectomy. My third surgery was 2 weeks after that.
The standard of care for inflammatory breast cancer is you'll get chemotherapy, you'll have a mastectomy, and you'll have radiation. And if you opt to have...
Immediately after my surgery, I was unable to raise my arm, I couldn't move it.
My main complaint was that I felt like my body was folding in on each other.
I couldn't even raise my right arm. You know, she said, you need a physical therapist.
She referred me here to Advanced Physical Therapy Solutions.
I think first and foremost, I really wanted to have a service available for women here in town. When you get a diagnosis of breast cancer, physical therapy is not the first thing that you think about. But I think physical therapy really needs to be included in the team of people that are going to be escorting you through this experience. And we need to be there because each segment of the process going on for the treatment of this disease is going to affect you physically different ways at different points along the experience. And you know, exercise again is part of the medicine that you're going to get in the treatment of breast cancer. Like any medicine, exercise needs to have the right dose, it needs to have the right frequency, it needs to be monitored, it needs to be adjusted. And those are the things that physical therapy brings to the table to help women through this experience.
When someone is newly diagnosed, we get the baseline of where they're at as far as their physical aspect, their measurements, things of that nature, so we can keep a record and make sure that if anything comes about that we're able to address it in a timely fashion. A lot of the patients come in and they're like, I'm just so tired all the time, I just don't have the energy. And it's like, we're gonna get that energy back. We're gonna work with you to get that energy back. My boss developed breast cancer, and she had to go through the struggle, and I just don't want any woman out there to ever have to go through this particular treatment on their own.
They help out a lot with just more than just the physical therapy and massages. It's more than that here. It's an awesome place to come.
I feel like I'm back to my old self.
They encourage me, they empower me, and they cheer me on as I recover, as I rebuild. It's an incredibly healthy environment, and I find safety here, I find love here, and I find an incredible amount of support here.
I think one of the things I'd really like women to know when they're diagnosed with breast cancer is it is not a death sentence. I want women to see that you can come back to a life that you had. We can help you with this experience. We can help you get through the different stages of it. Breast cancer is going to affect how you move. At Advanced Physical Therapy Solutions, we are committed to making movement better. And that's ultimately what it comes down to.